Have you ever stopped to think why your allergy medicine is a pill, but a nicotine aid is a patch, and a flu shot is, well, a shot? It might seem a little random, but the way a drug actually gets into your body, that's one of the most important, most strategic decisions in all of medicine.
And yeah, the choice between a pill, a patch, or an injection isn't just about what's easy. Not at all. It's a really calculated decision that changes everything, from how fast a drug works to how safe it is.
That's because what we call the route of administration, the path a drug takes into your body, that controls its speed, its power, and even its safety. It's a choice that totally changes the entire game.
In fact, pharmacologists say this is one of their most fundamental decisions. So, let's dive in and really break down the strategy behind it all.
Okay, so it all comes down to a balancing act. It really does. On one side, you've got the need for speed and intensity. Think emergencies. And on the other side, you want safety and convenience, especially for a treatment you'll be on for a while. Every single route is a trade-off between these things. So let's start with the category we're all most familiar with, enteral routes. You can just think of this as the everyday toolkit. These are all the methods that use your gastrointestinal or GI tract. Of course, we all know the oral route, swallowing a pill. But the GI path actually has other entry points, like under the tongue, which is sublingual, or in the cheek, which is buccal. There are even rectal routes, and each one has a very different job to do.
Now, take a look at this journey. When you swallow a pill, it has to run this crazy gauntlet. First, it has to survive the intense acid of the stomach. Then, it has to get absorbed in the small intestine. But even after all that, it faces one final gatekeeper before it can get to the rest of the body, the liver.
This toll the liver takes is a super important concept called first-pass metabolism. The liver basically acts like a filter, and it breaks down a chunk of the drug before it ever gets a chance to circulate. And that, as you can imagine, can seriously weaken the medicine's effect.
So, how do we get around these problems? Well, with some really clever drug design. Enteric-coated pills, for instance, have this protective shell so they can survive the stomach acid. And extended-release formulas, they're like little time-release capsules, letting out the drug slowly for a steady, long-lasting effect. And remember those other enteral routes we mentioned? Well, if you put a drug under your tongue or in your cheek, it gets absorbed directly into all the tiny blood vessels there. It's like a direct deposit straight into your bloodstream, completely bypassing the stomach and that liver toll booth for a much, much faster effect.
But what if just bypassing the liver isn't enough? What if you need a drug to work like right now at its full strength? For that, we've got to bypass the digestive system completely. And that's where the parenteral route comes in, the emergency response toolkit.
Parenteral is a bit of a fancy word, but all it really means is the drug doesn't go through the digestive system at all. Yep, we're talking about injections that deliver the medicine directly into your system.
And this right here is the biggest advantage. An intravenous or IV injection gives you 100% bioavailability. Every single molecule of that drug goes right into your bloodstream. No stomach acid, no liver toll booth. It's not just a bypass, it's a superhighway straight to where it needs to go.
But an injection isn't a one-size-fits-all solution. An IV is the fastest, for sure, but it's also irreversible, so the dose has to be absolutely perfect. For a slower, more sustained release, like for certain vaccines, an intramuscular shot into the muscle is the way to go. And for a really slow, steady delivery, like insulin, a subcutaneous injection right under the skin is perfect. Each one gives you a different level of control. And finally, we've got the specialist kit. These are routes that are designed for very specific jobs, targeting a very particular area of the body.
This category is incredibly diverse. It covers everything from inhalers that go right to the lungs to topical creams for your skin. Some, like transdermal patches, are still aiming for a body-wide effect, while others are super targeted, like intrathecal injections that go right into the spinal fluid to get past the brain's natural defenses.
Just think about an asthma inhaler. The inhalation route is absolutely perfect because it delivers the medicine exactly where it's needed, the lungs. It works incredibly fast, and it minimizes side effects everywhere else because the drug is concentrated right at the source of the problem. It's the same idea with the topical cream for a skin rash, right? It's all about that local effect. The whole point is to treat the skin without having the drug get absorbed all over your body, which, again, keeps those side effects way down.
A transdermal patch, though, that's a different story. It actually uses your skin as a gateway for a systemic or body-wide effect. It's engineered to release a drug super slowly and consistently over hours or even days to keep a really stable level in your blood. It's the ultimate slow and steady wins the race approach.
So we have fast routes, slow routes, local routes, systemic routes. How in the world does a doctor choose? Well, it all comes back to that central theme we talked about, the ultimate balancing act. They have to weigh all of it. How fast does the patient need to feel better? How convenient is this method going to be long-term? Can the drug itself even survive the stomach? What's the end goal here? And, most importantly, what is the absolute safest way to get there?
And at the end of the day, this really boils it down. Are you in a situation where you need the incredible speed and precise control of an IV, or is the convenience and relative safety of just taking a daily pill the right call?
So, the most important thing to take away from all this is simple. The form your medicine takes is never, ever an afterthought. It is a highly strategic, carefully calculated choice that's tailored to the drug, the illness, and to you, all to find that perfect balance for the best possible result.
So, the next time you open a bottle of pills or put on a patch, take a second. You now know the incredible science and strategy that went into choosing that specific path for your medicine. Kind of makes you see it differently, doesn't it?